Effective communication is central in healthcare teams. These teams always include the patient. In this video, a patient shares his observations on how communication helped manage a potential crisis.
At age 46, I had a sudden cardiac arrest and a heart attack that really transformed the way I both think about healthcare and how I'm trying to help to assure that it's a place that all of us have a sense of humanity and caring. For me, it was the arrival at cardiac rehabilitation that made a big difference in the ways in which I associated and connected with folks in the healthcare system.
Let's hear more of our patient's perspective after entering cardiac rehabilitation.
So when I arrived in cardiac rehab, what I loved about the experience was that there was an interaction between the interns, the exercise physiologist, and the sense of community that took place as a result of being part of this. I was obviously frightened and scared from having this event and was worried about the idea that I was going to come from just having a heart attack to actually exercising on a row machine and a number of things like that. And there was one incident that took place that did actually worry me, and I was actually pleased in the end what took place. I had low blood pressure throughout, and so oftentimes the staff would say, you're going to need to sit for a bit and just have some water. Probably about 6-7 weeks into the session, and I felt a little bit dizzy as I had, and one of the exercise physiologists noticed something in me that got them concerned. That resulted in being rushed over to the nursing staff and having them run an EKG and a number of things in my heart to make sure that everything was okay. And that experience was really frightening to me because I thought, geez, this has just happened again. But what I was pleased about is that the communication that took place between staff who actually typically did not meet with one another. But when there was an emergency like this, staff gathered together and assured that patient safety was paramount. So this past incident certainly worked out in my benefit and didn't have any issues. There are a couple of things that I was pleased about and some things that I'd love to take place. So the stuff I was pleased about was obviously the communication between interns, exercise physiologists, and nurses who didn't know each other were really quite effective in making sure that they did their work of assuring if I was having an incident, they were on top of it and going to be sure that I was safe.
Now that he has concluded care, what are his reflections?
What I would have loved is an opportunity for them to involve me a bit more in that process, to assure that I understood what was taking place. I understood the information that they were aware of. And I think the more that we can involve our patients in the process of understanding what the situation is, helping them to see what the clinical staff actually knows, the better that is for everybody. And I certainly feel happy that the answer to that question that day was that I just need to drink some more water. Overall, I actually think one of the most important parts about any kind of patient safety is that a relationship gets built between the clinical staff and the patients and their families. And the more transparent we are with one another, the more likely it is that we're going to have a good experience that assures that patient safety is actually the first and most important priority that everyone has when we encounter one another. So as I think about my own experience in cardiac rehabilitation, it was clear to me that my care team cared deeply about me personally. They knew what it is that may go on. Maybe it was new medications, maybe it was other things that took place. But in the end, what I think matters the most is that we have patients as a part of every team that goes forwards, that their voice can be heard, and that they're part of the process of effective communication.
Take a moment to reflect on Greg's story. His story is a reminder that effective communication with the patient is essential to provide quality and supportive care. Other patient stories and the entire TeamSteps curriculum are available on the AHRQ website.